कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Thank you very much.
Yes.
With those wonderful, prayer to improve prosperity and improve our knowledge, we start with a webinar, which is the third webinar of our Adolescent Health Committee. And this is exclusively on mental health. And we've got some stellar moderators and panelists here. I'll just share my slides. Yeah, I hope this is visible. So the webinar is titled Teen
Aruna,
Mind
let
and
us just give a
Digital
message
World.
from the hello.
Yes. The webinar
let
is
us-
called Teen Mind and Digital World. And I request our president, Dr. Durgadas Asrana, the president of the Karnataka State Obstetrics and Gynecology Society, to kindly give his welcome remarks. And if he's not around, would there be a message from him, madam?
Yeah, he has just expressed his delight that you have brought in such a pertinent subject for discussion today. It is the need of the hour, Aruna, and KSOGA is extremely happy that adolescent work for the adolescents is going on so very well with so much focus, and it is actually a very constructive frame of mind to conduct such webinars and then look towards some outcome in terms of, it should translate into better practices for adolescent healthcare by our audience. So, a very wonderful way of doing it. Only one panel with no talk, and the expert has been brought in here. So, it's a very good way forward. So, hoping for huge success of this webinar. All the best.
Thank you very much. And thanks, Dr. Durgadas Asrana, for your kind words. I hope he joins us soon. With that, just go ahead. Yeah. So I'd like to again thank our chief patrons, the president, our president-elect secretary, Dr. Shobha Gudi. Thank you for those words. And the treasurer, Dr. Shobha Bembalgi, and our EC member of the South Zone, Dr. Soumya Mani, is also a panelist today. I thank my co-moderator, Dr. Shobha Gudi, for taking up this responsibility, which is a big one, considering we just had our All India conference in Delhi, and we've just got back on Sunday afternoon and evening. And despite the busy schedule over the last 5-6 days, in fact, the whole week, you have joined in today. Most of you have been in Delhi for the entire week. So thanks a lot for joining in. And with that, I'd like to invite our guest speakers for today as well. Just a little bit of a brief introduction. Dr. Shobha, who just gave the welcoming remarks, is the Secretary General of the KSOGA. She's also the current president and the professor and HOD of St. Philomena's Hospital here in Bangalore. She's held many positions in both the Bangalore Society and the FOXY. She has been the chairperson for many committees in the FOXY and several publications to her credit. That's me, and I'm currently a consultant at Cloud9 Hospital and have special interest in adolescent health. And I currently hold a very responsible post of the chairperson of the Adolescent Health Committee of the Karnataka State Obs and Gynae Society. Now, coming to Dr. Samir, you can see that, his CV is actually, it runs into pages. But when I have to say a few words about Dr. Samir, he is a consultant psychiatrist and a mental health systems leader. He's not just into clinical practice, but he's led so many mental health systems leader. And that's the reason he's our expert panelist today. He's currently serving as the chairperson of the Fortis National Mental Health Program and the ADAYU. I don't know if I'm pronouncing it right. Is it ADAYU, sir?
Yeah,
Adayu. And is that Sanskrit for some particular meaning?
it's Adayu, adding value to your Ayu, so adding value to life.
Oh, adding
So
value
that's the
to Ayu. Oh,
mental health vertical for Fortis.
oh, that's lovely. That's lovely. I thought it had some hidden Sanskrit meaning, but that's wonderful. So it's a Fortis Group company, and he's just, in fact, started it a few months ago and has been very busy with that enterprise. He's known for combining clinical excellence with ethical governance and innovation, and he's built one of India's most comprehensive multi-city mental health care program and spearheaded the establishment of the Adayu Hospital Gurugram with the Fortis, I mean, it's the Fortis Health, Network Hospital, and India's first dedicated end-to-end inpatient mental health facility offering acute psychiatric management, de-addiction, rehab, neuromodulation, and integrated digital mental health services. So he's led large-scale preventive initiatives impacting over 15 crore people, pioneered structured workplace and school mental health programs and models, and served as the chief medical health expert to the Indian Olympic Association when it happened in Paris in 24. And Dr. Parikh also provides clinical governance to mental health organizations and serves as an advisor to the pharmacogenomics program at the Agilis Diagnostics. Published author of several books on mental health, he continues to shape mental health policy, practice, and public discourse in India and internationally. Sir, it's indeed a proud honor and privilege having you on our panel today. And it's amazing the kind of work that you're doing. And may God give you much more strength and dedication and passion to pursue this to to much higher sort of levels and, basically infiltrate the grassroots levels as well. Uh, yeah. And now, Dr. Preeti, I hope you're safely reaching your home. Dr. Preeti is our second expert panelist. She's a consultant adolescent health specialist and pediatrician here in Bangalore. She's a current director of the Bengaluru Adolescent Care and Counseling Center, clinical lead of the Adolescent Health Clinic in the Manipal Hospital in Old Airport Road, and she's held several positions in the Indian Adolescent Health Academy. And I think she's now the current chairperson of the Adolescent Health Committee of the International Society of Mental Health Advocacy and Action. She's also associate editor of the Clinical Child Psychology and Psychiatry journal. Who held many positions in the Indian Academy of Pediatrics, Adolescent Health Academy, both and locally and at the national level. Thank you very much for being here today, Dr. Preeti. You've always been a very, very supporting mentor for our society. Thanks for your presence and your lovely insights to come. Are you able to hear me?
Yes, I am. Yes, I am, Aruna. I'm
Yeah,
just
thank
joining
you
from
very
my
much for
laptop.
being here, Dr.
Yeah,
Preeti. Thank
yes,
you.
yes,
Thank
yes.
you. So we have a panelist, Dr. Bharti. Thank you very much for joining in. I was getting worried whether you would not be able to join, but thank you for
Thank
being
you,
here.
Aruna. Oh, thank you.
And
Thank you for having me here.
congratulations on becoming the chairperson of the Foxy Perinatology Committee. You've been installed
Yes,
only
I've
a
been,
couple of
this has
days
been
ago.
20, yeah.
Yeah.
Thank you,
Oh, yeah,
Preeti.
25, right?
I'm sorry.
Yes.
Thank you,
But
Aruna. Thank you, Aruna. Yeah.
and she's the immediate past president of our Karnataka State Obs and Gynae Society.
Uh,
Uh, who's coming from, I mean, hails from Gadag. She's a practicing obstetrician gynecologist and the current associate professor and the unit chief at the GIMS, the Gadag Institute of Medical Sciences. Thanks for Shruti for joining in. And of course, as you can see from her stellar CV, she's held several positions in the Gadag Society. Dr.
Thank you,
Soumya
ma'am.
Mani, hello. Thank you, Shruti. Dr. Soumya Mani is a very dear friend of mine who practices in Hassan. She has her own hospital there. She's a gynec laparoscopic surgeon, fertility specialist, colposcopist, and many other things that she does there, which is a very important, part of the tier two city sort of healthcare provider. And also, she has been the immediate past chairperson of the Adolescent Health Committee of the Karnataka KSOGA. Thank you very much, Soumya, for being here today. Thank you.
Yeah, thank you,
And
Aruna. Thank you.
thanks. And Dr. Aarti Raghu, finally, our last panelist today. Thank you, Aarti. She is joining from Bidar, and she's a member of the Perinatology Committee of the FOXY, and she's the current president of the IMA Bidar, and also a very, very active member of our Adolescent Health Committee of KSOGA. Thanks, Aarti, for joining in. Thank you. Aarti? Hello. Right. So
Hello,
with
ma'am.
that,
Good
yeah,
evening.
hi, Aarti.
Hello.
Please put your
Hello.
videos on, na, please, if you don't
Yes.
mind. Dr.
Okay.
Soumya, Dr. Bharti. The panelists kindly put your videos on. Um, so I think we will start off with the panel, if I can, if I may. Dr. Parikh, are you ready?
Yeah.
Yeah. So, Dr. Parikh, as you know, as I already told you, we are all gynecologists with busy OPDs. We see a kind of gamut of patients from adolescence to menopause, right? And we have about 10 to 15 minutes to spare for every patient that we see in the OPD, as must be, I mean, unlike psychiatric consultations, possibly. So, why should a busy gynecologist think about mental health in every adolescent consultation, or for that matter, for any consultation?
No, but I think it's not a question for gynecologists. I think it's a question that applies to any medical practice.
Yeah.
Right. So, for example, let's say you have a patient who is having some edema. So, you may want to look for diabetes. So, it's not that you are not looking at endocrine. Similarly, let's say you have a patient who's having, let's say you are seeing a patient who's having headache. So you may want to rule out something, let's say a migraine or something like that, which is neurology. So fact of the matter is that health is a complete aspect. Adolescents who typically tend to be a lot of times physically healthier and have more concerns around mental health a lot many times, especially when it comes to their body image, the impact of relationships, the pressure aspect that they have. So, because of that, it makes sense. But, like I said, any physician sitting anywhere needs to be able to understand that mental health is important, and that may be the differentiator eventually in the overall prognosis. That's the only way to look at it.
Sorry, I was on mute. Sorry. Um, that's absolutely right. So I mean, but I mean, we'll come to that. Dr. Preeti, do you have any insights to this question? Why is it so important to look at mental health in every adolescent consultation? Are you able to take this question, Preeti? Have you reached home?
Yeah, I have reached home. I'm just trying to put on my laptop. But anyway, I'll just answer this. So, we say there is no health without mental health. And health, the definition of health is beyond physical health, right? So it also includes mental, psychosocial, emotional, spiritual, and even digital health. So I think as what Dr. Samir said, it is an important component. That is one. Second thing is that we all know that the adolescent mental health issues are on the rise, and especially after COVID, there's almost doubling of mental disorders. So our antennas should be up. And the earlier, as with any medical disorder, the earlier we pick up, the better is the prognosis and better is the quality of life. As we all know that mental health really impacts all parts of life, and in a phase when there's biosocial development, definitely this plays a big role in their adequate growth and development. The third reason is that 50% of the mental disorders present before 14 years of age. And we know that adolescents are usually have poor health-seeking behavior. So any clinic, I would say any clinic, it may be a gynecologist, it may be a pediatrician, it could be a medical specialist, they should have a basic kind of fundamental idea about mental health, because mental health is a part of overall health, and we would be doing an incomplete job if we are not picking up mental disorders early and treating them adequately. And we all know mental health issues have a big implication on non-communicable diseases, and non-communicable diseases are on the rise right now. So all the more reason, and they track into adulthood. So if we have to make a difference to our adult mortality and morbidity. And as gynecologists, you know the impact of adolescent undernourished girl with anemia giving birth to a low birth weight baby, which has implications over the entire lifespan. So I think adolescent is
Yes.
the age to work on, and mental health is an important component.
Absolutely, absolutely, Dr. Preeti. But Dr. Pani, would you be able to give one real life example where early mental health recognition in your clinic or gynae clinic or in a gynec situation changed the trajectory of the girl? I mean, any real life example that either of you can give?
I mean, it will be endless, to be honest. I mean, let's say some, I mean, and the fact is that most often, adolescents tend to visit their physicians
Yeah.
before their psychiatrist. I mean, we have to accept this fact. So whether it is coming for one reason or another, or coming to a gynecologist, it's those a couple of questions and you will realize that. So whether it is depression, anxiety, body image, lifestyle, sleep issues, relationship issues, any one of these things could present itself with somatic complaints, with fatigue, with impact on periods, with impact of a lot of somatic pains and frequent visits. So the moment you ask and you give what we call a psychological first aid, just those 2 minutes of how you are doing, is there something bothering you? Would you want to talk to someone? And then give a empathetic validation.
Yeah.
And then say, okay, why don't you talk to a colleague, or have you talked to your school counselor?
Yes.
Something around lifestyle. These things can actually make a huge difference. And it's not more than a minute or 2 minutes that it takes. But the approach, which is of the psychological first aid approach, where empathy, non-judgmental, validation, affirmation, some of these things will actually make a difference.
True. Absolutely. Yeah. So, yeah, maybe Dr. Preeti, would you want to tell any other example as per your experience?
I
Right.
think what Aruna is looking for is a real life case scenario where,
Yeah.
some
Yeah.
intervention
So,
might have helped. Yeah.
hmm. Anyway, I think we'll go on to this next important
Yeah,
question. Dr.
there
Shobha,
will
would
be
you mind? Would you mind taking this question? Yeah, please. I mean, asking this question, I mean.
yeah. Why not? I think, Aruna, what you wanted was something like an adolescent coming in and,
Yeah. So,
sometimes they
like for
don't.
example, we do have a lot of young girls coming in with PCOS. I mean, who either have been overdiagnosed or undiagnosed or properly diagnosed with PCOS, having very, very severe body image issues with their acne and obesity, and also the mood disturbances which happen in PCOS. And these are the kinds of girls that we've seen definitely have hidden psychiatric issues, which,
Oh, they
if addressed
definitely
at
have.
that
They
stage,
definitely have.
it can,
And
yes, yeah,
if we are kind of astute enough, we will realize that there are features of depression, the
yes,
features of anxiety, and I
yeah,
don't know
yeah,
what else. And sometimes they
absolutely.
lack sleep and they have, that midnight binging to feel better,
Yes,
etc.
yes,
So
yes.
then let us just move ahead on more discussion. In our setting, what do you see as the top three mental health issues? Already we mentioned some of them affecting adolescent girls that gynecologists are likely to encounter first. I think we gave in our experience, but then we would like the panelists to say, directed to Dr. Samir Parekh, and also your perspective. Do you see the same top three is what Preeti can tell next? So let us begin with Dr. Samir. Yes, Dr. Samir. Yeah.
You'll have to say that question again. I missed it in between.
Yeah. What do you see as the top three mental health issues affecting adolescent girls?
I mean, globally, it is going to be the same. You are looking at anxiety and depression being the topmost. And then you'll need to look at a combination of body image,
Mm,
relationship, bullying.
mm,
If you look at these three aspects,
mm.
then you'll be covering. So one would be more clinical, which is depression and anxiety. Other being
Correct.
not so much clinical, and it's going to be body image, bullying,
Mm,
relationships. And this is a fact. And
mm,
because for these issues, especially bullying, um, relationships, and body image, young people don't really like to talk to people.
mm.
They tend to keep it within themselves, which actually in the long run creates more problems. And they're
Yes.
more likely, very much more open, be able to talk to their gynecologists on this,
Mm,
especially body image. and even relationships. So I think that's
So
something.
are there any telltale signs for these? What mental health?
Yeah.
Are there
I think
anything that you can tell us as a
So
guide?
I would look at very basic things. If you feel somebody whom you are seeing frequently, if you feel a change in mood, the
Low mood. Mm.
cheerfulness, mood
Mm.
changes.
Mm.
Or if you are told that it would also be with, let's say, more physiological, which is appetite, weight,
Mm.
sleep,
Mm.
pains,
Okay.
aches. Or
Somatic manifestations.
let's
Okay.
say,
Mm.
uh, cyclical changes happening, especially mood changes, irritability, tearfulness happening in
Mm.
and around the period cycle.
Mm.
Or you are looking at them sharing that there have been changes in their academic performance, or
Mm.
parents coming and telling you that this
Definitely.
person
That can be got. Yes.
different
Mm.
of some of these things. You look at any one of
Mm.
these things, a
Mm.
couple of questions: how's your mood? Is everything fine with you? Would you
Mm.
want to talk by yourself and we can ask your parent to go out? Is there
Mm.
something that's happening? Some of these things would
Exactly.
actually work.
Mm. Correct.
yeah.
Correct. Preeti
So
wants
Dr.
to add to that.
Yeah.
Preeti, Dr. Preeti.
So I think what Dr. Samir said. Yes, can you hear me?
Yeah, we
Yeah,
can
we
hear
can.
you
Can you
now.
hear me?
Mm. Mm. Yes, we can. Please go ahead.
Can you hear me? Okay,
Yes, we
okay,
can.
okay,
Go
okay,
ahead.
fine. So to what Dr. Samir, right, to what Dr. Samir already said, I would also add problematic internet use and post-traumatic stress disorder, especially after sexual abuse. And for neurodivergent adolescents, adolescent girls, it's an entirely different set, which we see the issues
What
that
do you
we
mean by
have with.
neurodivergent?
Yeah.
Okay, so with the which are, to put it simply, which are not neurotypical,
Mm.
and the disorders which cover are under this are adolescents with intellectual disability, with autism, with attention deficit hyperactivity
Mm.
disorder, with
Mm.
learning disabilities,
Mm.
also with gender issues,
Mm.
right?
Mm.
And LGBTQI. So
Mm.
we have a certain different set of mental
Mm.
health issues with these adolescents, and they need special care as well.
Mm.
So that is another thing. And those are also with chronic mental disorder, chronic
Mm.
physical disorders, like,
Mm.
those with epilepsy, those with diabetes, right?
Mm.
So they would have not only adherence problems with adherence and compliance to their treatment, but also as they go into the adolescent age group, they would also have other issues like peer related issues, and this rather needs more mental health help in this part of life. And I'll tell you, menstrual history is, we consider it as a vital sign. It really gives a lot of information
Mm.
of the
Mm.
overall well-being of a girl. So I think
Absolutely.
it's a really
I agree
crucial.
with
It's
you.
crucial.
Yes.
And
Yes.
it gives that mind-body connect, which we
Mm.
should all be, kind of aware about.
Mm.
So that's the importance when gynecologists
Yes,
are
well
in
said.
the,
Yes. Mm.
when they are
Mm.
seeing. Yes.
Very nice. Aruna, you can safely go to the
Yeah.
next one. Yeah.
Yeah, absolutely. Absolutely.
Mm.
Dr. Bharti will come to a gynecologist now, and none other than Dr. Bharti. In your everyday practice in OPD, what are the common adolescent presentations where you suspect there's more going on beneath the surface? Like, what comes to your mind, and how do you, in your practically, in a few lines, how do you think you'll be able to get to the bottom of it? Unmute, madam. Please unmute.
Thank you, and my regards to Dr. Samir and Dr. Preeti for being on the KSOGA platform. Well, I think if you're a good clinician, when you have an adolescent walk into your outpatient, you can definitely have a clue as to this girl is having some subtle mental issues or serious mental issues by her appearance and by sometimes apprehension, the way she's tagging behind her mother, she is not ready to talk to you, and these are some subtle clues that may be. And along with that, she may be having the presentation to us with either an abnormal uterine bleeding or absenteeism from school because of dysmenorrhea, or she may be overweight, or she may be conscious of her body image because of PCOS and the hirsutism or the acne or hair loss. They generally present to us not with any mental issues. They will only come to us with one of these gynecological issues. But when we sit down and take the history and we start speaking, and you generally we have the mother or a parent with them, and the parent keeps on nudging, or she keeps nudging the parent, and the parent is sometimes sort of bringing out a lot of complaints on this girl, and she sometimes breaks down, or sometimes she becomes silent, and sometimes she even walks out of the OPD saying, I don't want to get any treatment done. I think there we need to be a little compassionate and empathetic, and we need to sometimes say, I need to talk to this child alone. And I generally do that, and after I make them wait for some time, and I just give her a chart. I give her a chart to just write down certain things, or I give her a chart which says, do you sleep well? What is your diet? What exercises are you doing? And all these things, and call her back after a few minutes so that she gains confidence. We sit and talk to her alone first, and then she will open up with what type of issues. And most often it is anxiety, sleep issues, binge eating issues. These are the initial pointers. And then when you start, there may be a sort of a rapport between the parents and the child. The parent is always complaining about the child, whether it is her exercise, whether it is eating.
Yes.
And I think, and we have to address the parents also on this. But of course, we are not going to tag them saying she has a mental health issue. We have to very subtly see that her mental issues are addressed along with her physical health issues.
That's a wonderful way of, dealing with it. So you give them a chart where they can fill up and come back and then talk to you in a much more relaxed manner. Very nice, Dr. Bharti. Thank you.
Thank you.
So Dr. Parikh, coming back to you, what are the 3 to 4 simple screening questions that a gynecologist can reliably use in under 2 minutes to pick up possible anxiety, depression, or even a self-harm risk? How would you guide us about
Self-harm
that?
risk is a tough one to just randomly put in 2 or 3 questions. It should be there only if there is anything else which is making you feel there is a need for self-harm. So that's not something that I would want you to just offhand ask.
No, of course
Asking
not.
about
Yeah.
mood is fine. Are your moods fine?
Mm-hmm.
Are you being cheerful? Are you having any worries? Do you get excessive thoughts? Is your sleep fine? Are you enjoying with friends and at school? That's enough.
Right. Yeah.
If someone says, I've been feeling very low or I'm not really liking it, then you can say, okay, then you can probably ask a couple of questions around that. Okay, what do you mean by that? When you feel low, what do you do? Do you talk to someone? And if that leads to something more, you can ask that, is there anything you want to tell me? But not just going for a question like, are you having self-harming thoughts too soon? I don't advise that.
Absolutely. No,
Yeah.
self-harm,
I
as you
think,
rightly said, is a
Karuna,
red
I
flag.
understood what
Yeah.
Dr. Samir is trying to convey. I think he is asking us to be subtler, more subtle when we are dealing with mental health issues.
Yes.
So because what we do is usually when it comes to physical health, clinical health, we are actually very, very kind of objective about it, because we want to know how much is the menstrual blood loss. We want to know whether she is under-reporting her symptoms, right? And we are very keen about diet patterns, exercise adherence. And actually, it will come across as very intrusive, and the adolescent might take it as some, not as a doctor, but somebody who's trying to invade her privacy. So what he is trying to tell us is to have a gentler approach, more subtle. I think
Also, I think it's
practitioners have
very
taken the
important.
cue.
Also, very important to understand that if you are asking these questions, confidentiality is
Should be
sacrosanct and
assured. Yes.
automatic.
Yes.
Because
Absolutely.
since typically young people come to you with their parents and they've known you through their parents, they have this fear on the back of their mind that what if you talk to the parent?
Yes.
So somewhere if you feel that the young person is a bit not feeling like really being there, then you will have to preemptively say this. Whatever you say, it will stay between us, and you send the parent out. It's very important to do this also.
Absolutely.
To give them that assurance that confidentiality will be maintained.
Yes.
Absolutely. and
Doc-
also handle them with kid gloves. Yeah, handle
So, Dr.
them
Preeti, you
very.
were talking about menstrual health as a vital sign for mental health. So, would you be able to give us a mini screen which we can use in our OPD, just like Dr. Tariq said? Anything that you'd like to add? Please unmute her.
Yes, so I think, the first thing is any child above 10 years, you must spend a few minutes alone with the child. That should be like, a rule in the clinic. So, as Dr. Parekh already said, offering privacy, confidentiality, I often, ask these two questions. Any worries or anxieties? And the second question I ask is, how are things at home, school, with friends, and on the digital world? So this covers all the domains of an adolescent's life, right? So these are the two questions that I ask from all adolescents coming for whatever reason. It might be for cold and cough also to my clinic. So I
Uh-huh.
would say that you please take them aside and ask these questions. That, and if they say there are some worries or anxieties or things are not, then you would need more time with them. I always then give them a time to go further into details, because as you said, in a busy OPD, it is better not to in a hurry say judgmental things and do it, and rather give them time to go deeper into it.
Sure, sure. No, absolutely. I think following on the same the same sort of thought, let's go to a case study. I mean, this makes it more practical. A 16-year-old comes with severe dysmenorrhea and frequent school absenteeism. Investigations are normal, but at what point should a gynecologist start thinking, is this more than a mental health, psychological, psychosocial issue than purely gynecological? Dr. Soumya, would you mind taking this question first, and then Dr. Parikh can add on his comments? Dr. Soumya Mani?
Hello.
Yes, we can hear
Yeah.
you.
Thank you, Aruna. Thank you. Looking at the case, like whenever a girl comes to us with dysmenorrhea or vomiting or generalized weakness, whatever it is, in the first sitting, we would treat her symptomatically. The first thing is we have to spend more time with her, convince her and counsel her regarding to adopt a healthy lifestyle. We have to convince her to adopt the healthy lifestyle and call her after 2 months. Suppose if you feel if she comes with the same symptoms, or if you find any poor academic performance, we need to think. We need to rule out the organic causes in that.
Right. Yeah. Now, when this girl is
And
coming with
also
severe
the
dysmenorrhea,
yeah,
and
and also
she's
the most
being absent
important.
from school frequently. Yeah.
Yeah. On the
Sure.
day, like she will be normal. If you give her responsibility again, she will be absent from the school. Something like that.
Mm-hmm. Dr. Parikh, any thoughts on this? And Dr. Preeti, yourself as
I mean,
well.
you'll have to
So
look at
this,
this from an angle of absenteeism and its correlation with dysmenorrhea. You'll have to look at that as well, which means how close is dysmenorrhea and absenteeism happening? I think that's a question you need to ask yourself, as in how many days it is happening and why is this young person skipping school? You will need to see that as well.
no, but then
Uh,
this girl is telling us that it is pain and it's severe dysmenorrhea, and that's why I'm skipping school. And she's a 16-year-old.
no, but
At
for
what
how many
point should
days?
we
How many
start
days? How many days is an important
about
question.
four days, 3 to 4 days?
So
And at
yes,
what point should we start worrying? Okay, there's something, mental or psychosocial going on. So that probing is what I wanted to ask
so
about.
typically you will actually also, I mean, if this was me, then I would have actually wanted to see what happens on the remaining 25, 26 days, right? So if there is a psychosocial issue happening, then the odds are that the remaining 24, 25 days will also be one way or the other be affected. It's unlikely it's only going to be these 4 days.
Sure, sure. Dr. Bharti, you
Rule
have
that
something to
out.
add?
First, you rule that
Sure.
out.
Yeah.
Yeah,
Once you
yeah.
Though
rule that
she's
out,
16-year-old, we have to first.
One second, Dr. Parikh. Did you say something? Just rule that out and then come to. Yes, I
and
got
then
it. Yeah.
once you rule that out, then you look at how much is the pain versus dysfunctionality. So if you feel that the somatic component, which is expression, the disability of the somatic component is a mismatch, then you should actually look at mood, sleep, stress. If any of them are a yes, then you can probably then reevaluate. That's what I would have done.
Sure, got it. Dr. Bharti.
Yeah, so what I would like to say here, Dr. Aruna, is though she is 16-year-old, we have to rule out the somatic issues, organic issues beforehand, because we all know that ovarian cyst, dermoid, endometriosis is quite common in the younger age group nowadays. And many a time this dysmenorrhea, as we see, is just treated for months and months, and then we see there's an organic
Yes,
lesion.
yes,
That is
yes.
one thing we have to be very, very important. We cannot just maybe one visit, two visit, we've given her some antispasmodics, we've done the counseling, we've done the lifestyle modification, and still she comes back. It is time to think of an organic lesion. That's the first thing. And the second thing is, in confidence, we will have to talk to this girl alone whether there are any other issues in school which is preventing her from absenteeism. Like, for example, there may be some sort of an abuse, physical, verbal, or a mental abuse going on in school, or there may be some learning difficulties for her which may be presenting as a psychosomatic problem. And this may not be totally a mental health issue, but if we do not counsel her, we do not address the triggering agent, she may land up with serious mental issues later on. I just wanted to add this.
Absolutely. Dr.
Thank you.
Preeti, you also had something to add.
Yeah.
Please go ahead.
Yes, so I would say don't separate mental or psychosocial issue from your physical. As I said,
Yes.
screen all. Screen all right from the beginning. It may be ultimately a physical. Now, when you ask these questions, any worries, anxiety, how are things at homeschool friends and the digital world, this will also help you to build a therapeutic alliance with the child. And it will give the confidence to the child to share their problems. So I would say, do not separate the two. At what point do we start? You think of psychosocial issues, physical health issue, mental health issues all together. All together. Treat the child as a whole is what I would say.
Absolutely.
Yeah,
Right, right.
I agree with Preeti, Aruna. I agree with
Yeah,
Preeti that
absolutely.
one has to give very high attention and empathy for the menstrual problems that she is having. Because
Sure.
menstruation is actually an understatement when women's health is concerned. It's actually a very distressing, a part of reproductive life. And especially for young girls to adjust to that and carry on with their studies and homework and sports
Yes,
and peer
yes, yes.
interaction, social life, menstruation in itself is a slightly incapacitating till they understand how they can best manage it. And I would just
Yes,
recommend here that we should start strongly recommending all adolescents to go for menstrual cups. It really improves quality of life.
yes,
And
yes.
probably it will make them more relaxed and they might be able to cope with their mental health issues better. And I feel that there should be absolutely, high empathy and tips and tricks to reduce dysmenorrhea, like resting appropriately and having appropriate activity and hydration and good nutrition on these days. All these things will matter. So one cannot really separate because for her to feel good, she requires good menstrual
Yeah,
health also and an address of her mental. So I really agree with
yes,
Preeti
yes.
because
I totally, yes, the vital
yeah, the
sign of
first
menstrual
7 or
health is
8
mental
years
health,
of
and mental health, the
menstruation.
vital sign is
uh,
menstrual health. So I think it's
See, a woman
we have to
menstruates
get
for
into
some
that.
25 years or so, 25,
Yeah,
30, but it is the first 5 years. It's very difficult for her to adjust to the
true, true,
fact that she
true.
has to bleed every month,
Yeah,
especially a young growing child. So I feel that there should be a
yes,
strong connect.
true,
Having
true.
said that, we need to really define ourselves about identifying mental health issues. So please
Yes.
go ahead with
Yeah.
asking
So
Dr.
I
Sameer.
think
Yeah.
that's great. So I think we've already covered the brief validating tools, which which both of you have very clearly talked about. We'll move on to eating disorders a little bit. So, Dr. Panik, how do we differentiate between a normal teenage dieting, as against a possible eating disorder? How would you, you know, probably, let us help us know about that?
You need to split the eating disorders in, let's say, very broadly. And I'm doing a very broad, not getting too pinpointing too much onto this.
Yeah.
One where there is a restrictive diet pattern, other where there is an episode of eating followed by some kind of a compensatory behavior, right? The key component is going to be body image, concern around being fat, in the absence of the obvious still feeling that there is a concern around body image. The eating pattern is way too strict and does not have the leeway to some changes and fluctuations. Parents share that eating has become almost like a war ground at home.
Right.
Things would be there. If there is by any chance menstrual irregularity happening, that's a definite red flag. If there is significant weight loss happening, definite turn. And and I think this is something which is important because eating disorders largely go unnoticed. Eating disorders are called egosyntonic, which means patients themselves do not seek do not seek treatment. Okay, because they don't seek treatment and they think they are fine. So that results into uh, not wanting help and thinking what they are doing is fine. So eating disorders is actually a tougher mental health condition because you are going to go against the egosyntonic aspect. So that's how
Right.
I would look at it.
When you say egosyntonic, it means that
I'm okay
they
with
are
it.
not volunteering to come and ask for help.
In fact, I'm
It's,
okay with it. So if I'm
but I'm okay
depressed,
with it.
I'm
And
coming
that's
to you that I have distress, help me out. But in
right.
here, I don't want help. I'm fine. My losing weight is the right thing.
Right, got it. Yes, that can be very tricky. Dr. Preeti, what do you have to say about this? And yeah, maybe a simple 5 question framework that we can try and use in our gynae OPDs, please.
Okay, so I'll just give one question. How do you feel when you look at yourself in the mirror? That is usually, my opening kind of a thing to screen for eating disorders. And what are you
Right,
doing to ensure that kind of body image that you have in your
right.
mind, you know?
Okay,
So,
okay.
so that could be a kind of an opening intake. And I also would like to bring focus that usually it starts as disordered eating, they start skipping meals, and that is when you need to pick up. And then before the DSM-5, criteria of eating disorders or binge eating disorders, all those come up. So if
Mhm.
as gynecologists, you can pick up when the parent says, oh, she started eliminating some diet, or she's spending a lot of time on the social media, and then she gets low. So how do you feel after you see the social media? Oh, I feel terrible. I feel the others have got a better body. So these are some questions and very simple questions to ask, which will give you some indicators. Now you asked about validated tools. So in interest of time, what I'll do is for each condition, I'll put some validated tools in the chat. So SCOFF is one tool which we use for screening for initially for eating disorders. And SCOFF is an acronym which stands for, do you make yourself sick because you feel uncomfortably full? Do you worry you have lost control over how much you eat? Have you approximately lost more than 15 pounds in the 3-month period? Do you believe yourself to be fat when others say you are too thin? Would you say that food dominates your life? And the answer to yes is in more than 2 cases, maybe an indicator, initial indicator to an eating disorder, right? So this is some of very simple things which you can do in clinical practice.
Oh, sorry, I'm muted. Thank you for sharing that, Dr. Preeti. Very interesting. And please do share it on the chat box. In the chat box, we'll look it up. Now, let's say, Dr. Aarti, this is a question for you, all right? A 14-year-old athlete, okay, she's an athlete. She does 400 meters and relays and whatnot. Presents with secondary amenorrhea, right? BMI is low normal, okay, probably about 18 for her. Parents are very proud of her discipline. But then, how should the gynecologist approach possible relative energy deficiency like disordered eating, and when must we involve a psychiatrist? Dr. Aarti, you can take this question first, and then Dr. Samir, because this is not an uncommon situation. I see plenty of athletes in OPD. They will be even in the national sort of levels, etc. So, Dr. Aarti, go ahead.
Yeah, good evening, ma'am. Here we have 14 years girl. She's athlete, means her physical activity is more. She is every day undergoing hard training, and sometimes her parents are telling she's disciplined. Means she is very much serious about her daily workout. And sometimes what happens, they lose so much of energy they during their workout, but they are always worried about gaining weight and all, and because of that they restrict their diet. And because of this relative energy deficiency in sports, we call it red S. And because of that, there is usually hypothalamic suppression. And because of that, they will have amenorrhea. And we have to actually, as Madam Del Priti ma'am, we have to spend some time with the adolescent alone, and we have to ask her what is in her mind, how she is feeling about her body, and what is her daily routine about her workout, and what diet she is taking. And we have to tell her that she is doing excellent as an athlete, but she has to match her energy by eating good, because in long term it is not only a menstrual problem, but it can affect her bone health and even cardiovascular health. And eventually for her fitness, she is doing this training and she may not be fit for that training.
Yeah,
She has to
absolutely.
seriously think about it, and we
Yes.
have to just make her aware that she has to, and her body is growing. She is adolescent. She needs much more food, nutrients, calcium, vitamin D, and all
Yeah.
iron. She should not be anemic in that.
Yes. Yes. Thank you, Aarti. That's a very holistic way of looking at it. Dr. Parik, in such situations, you must have seen a lot of sports, adolescents who do sports on a regular basis. What are the common things that you find in them, and how do you stratify risk in such situations if you think it's disordered eating?
No, I think so. First, I mean, sports, yes. In fact, I had gone to the Paris Olympics
The
with the
Olympics,
Olympic
yes,
team.
yeah, yeah,
And this was the first time mental health practitioners were actually sent with the Olympic team. See, how I see this is very different. When I talk to young athletes, budding athletes, and I understand that based on the nature of their sport, they need to have a certain body type. So let's say for boxing, weightlifting, it will be different. For let's say gymnastics, it will be different. Swimming, it will be
yes,
different.
yeah,
So one
yeah,
needs to understand that, right? Any routine that they have, which is helping them in their sport, but causing them any physiological impact or
yeah,
a mood impact, so which is either the psychological or the body, has to be addressed. So if I would have had this kid at 14, I would have said that, listen, if you're having these amenorrhea episodes, then we need to address it without compromising your uh, pursuit of your field of sport. We'll need to find that balance. Otherwise, today you may feel you are at your best,
best,
but
yeah.
if physically the body is deteriorating, then it's going to be a problem soon, and you need to have a 10-year span of a career or something like that. That's what I would have done.
Right. Dr. Preeti, what do you think we should do if we are suspecting a eating disorder? What are the red flags where we really need to immediately refer them? And what should we say or avoid saying such situations? Because as you mentioned that particular word, Doctor, which I forgotten already. Ego.
So I think as a gynecologist or as you know, for any other doctor, I think when we suspect an eating disorder, we must do a basic investigations.
Right.
Like look out for anemia, look out for hypothyroidism, vitamin B12 deficiency. I think all these are important in the
Right.
overall management of
Right.
any kind of not only for eating disorder, but for any kind of mental disorder. So we should not, lose out. Anemia can present as any mental disorder. So that is an anemia, as we know, 40% of our adults and girls are anemic in India. So I think we need to first be very clear. We should rule out vitamin B12 also, very, very important. Right now, the thing is, eating disorder, if it is definitely diagnosed, definitely it will need a multidisciplinary collaboration. And if it can also present as hypertension and shock,
Yeah.
and
Mm,
it can be also one of the causes of adults and mortality. So
mm,
we have to take it really, really seriously. And
right.
it may, depending on how severe it is, it may even require a hospital management. Okay, so
Sure.
what
Sure.
we tell the adolescent, will be in proportionate to the severity, whether a hospitalization is required or whether it can be managed on it. But remember, we need to collaborate with a mental health professional here, which is going to be really, really important. I would say that. So this is one of the indications when collaboration is going to really help, because you know the child from a longer time. Obviously, they trust you, and listening to the in
So,
clinical
yeah,
practice in the initial stages, I
correct.
have found growth charts are very powerful way. Of all
Mm-hmm.
adolescents want to be healthy at the end of the day, and they are
Right.
concerned about whether they are. So I usually show them the growth charts and say, you are here, right? And we use a technique when we always talk for behavior change. We use a technique called motivational interviewing. What matters to the adolescent really? So like when I come back to the sports thing, they want to play sports well, right? They want to be champions. So for being champions, you want to be healthy, right? And what you're doing wrong, so it should fit into their scheme of things. It's not that, oh, you grow well. He may not be even bothered about his growth. What he only is bothered about is sports. So we use that as a talking point and then motivate them. Obviously, no things which further aggravate the body image. Hey, you're looking very thin, or you're looking very fat. The last time I saw you, you were, looking much better. So these are the judgmental issues which definitely are a strict no, right? So with what complaints? Oh, so the mother says she's not been eating well and she's been feeling fatigued. So then from there you start. Your mom tells me that, what do you feel? Are you really feeling fatigued? And what do you think are the causes for that?
Yeah,
When you
so
ask in
Preeti,
privacy. I think
Aruna,
that's the
and
way to go
yeah,
about. Yeah. Yes.
Preeti and Aruna, at this point of time, let me kind of bring in a little bit of a practical obstacle to this kind of. Huh? You see, we have understood that the adolescent health problem is transsectorial, multisectorial, very, very, for a very long time now. Gynecologists understand that we are not the only people who can make a difference. We need government policies, we need educational systems and their teachers, we need parents, we need communities, we need social welfare groups, etc. Then only we can do some justice. It is a lot, and today I think adolescents' perspective of the world has changed. They'd have passion for the wrong kind of things for what we had. I mean, there's a lot of change in their perspective. So all that also makes a difference to their attitude towards health. What I am trying to bring in here is reference to the mental health specialist. Is even today in India, though the parents might be very modernistic, very well read, educated, it is taken with a slight stigma, and they feel a little cross when we tell them about. So, how do you navigate this? You said that you will look at growth charts, you will look at general health outcomes. That is very good, but then this kind of barrier towards mental health, seeking mental health care, we need to bring in some solutions to this barrier. So early on, we can have a cross reference. I think it is very, very important to have an early reference to a mental health specialist whenever we find something. So there should be no delay. So how do you come across, navigate this barrier? Yeah.
Very important question, Dr. Shobha. Yeah, please go ahead. Dr. Parikh, maybe you can take this question first.
Uh, the important aspect is to recognize that stress, bullying are real parts of our life. The 2022 report of WHO, which is a comprehensive report on mental health, talked about a couple of things which we need to all understand. One, bullying leads to long-standing mental health issues. Two, community mental health is one of the main pillars of preventing the significant morbidity which is coming because of mental health right now, almost like an elephant we don't see. It'll become a lot more in our faces in the future, given that there was a 25% increase in anxiety and depression post-COVID. 280 million people or so in the world suffer from depression and 300 odd from anxiety. These are some facts. You put this in the context. What can we do? Teachers, education system, gatekeeper physicians. So from family physicians to and GPs to internists and gynecologists, pediatricians are where initial interface is happening. In that interface, asking questions about well-being, comfort, sleep, body image, happiness, moods will actually act as an intervention also. Because when you go for, let's say, a physical examination or a physical concern, and you are asked certain questions which are more about your overall well-being, that also is an intervention. And that results into to talking to you. And that's the future for mental health. Mental health's future, at least in our part of the world, is not going to be psychiatrists. Because no matter what we do, we don't have enough of them. So the burden of care of mental health is going to be at all these levels. So when you will be able to solve some of the more here and now aspects, give a bit of guidance, some bit of psychological first aid, you'll actually reduce someone going for an extra counseling which would have otherwise not been needed, and that slot can be taken care by somebody who's having more concerns. That's the approach one needs to have.
Right. Yeah. No, I think Dr. Parikh, yes. I mean, the main thing is Dr. Shobha was trying to understand how, as all of us, in multi-sectorial way, can collaborate with schools. Schools have counselors nowadays. Every school would have a counselor. But then, they may not go to the school counselor. They may come to the adolescent health, the gynecologist or their primary physician. So how do we all collaborate in order to improve our adolescent mental health, holistically? And what is it that we can do in the future to get these children to actually open up? And as Dr. Shobha was saying, break the barriers, not have the taboo, open up and seek mental health early on so that it doesn't escalate to that extent. So what are because you have done these systems, yeah.
So when you talk to students, teachers or parents about any topic, make sure you spend about 3 to 4 minutes on mental health related aspects which fit in with your topic, because there will always be something, right? The second aspect that you look at is when someone comes and talks to you, you actually reinforce the counselor. So when you would reinforce the counselor, it will work. When you are doing an activity or a conversation with parents, teachers, or students, involve the counselor. Maybe ask a couple of questions. So what that does is it normalizes into the counselor. And school counselors seeing initial references is again important for this prevention of cascading of problems, where you don't want people who don't need to be seen by a psychiatrist or a psychologist to be going to them. So we have to look at it from that aspect, given that we have a 300% shortage of experts.
Yeah, right. Yeah, we have Shipra, Shipra Lamba, who is a counselor, a psychologist, clinical psychologist at Cloud9 Hospital, where I work. Shipra, please go ahead with your question.
Yes, thank you, Dr. Anna, for introducing me, and thank you for having me here today. I've seen three patterns going on a lot. One is that patients are coming in, adolescents are coming in, but for the parent, it is that, our child is scoring well. So everything is fine. Nothing else matters because they score well, they study well, it's fine. Other thing I see usually is that, parents brush off their hands as soon as the child is sent to a psychologist. It's like, almost now this child is your tension. It's like that. Third thing I'm seeing is a little offbeat nowadays, that many teenagers have become very, aware that, there is something called mental health. So teenagers sometimes they do come out themselves also that help us, but then the system maybe is not open to it yet, that a child is asking openly for help, not their parents first. So these three challenges I am facing nowadays more with adolescents, and repeatedly actually.
Right. Dr. Preeti, what do you have to say about Shipra's problems, challenges?
Shipra, thank you for bringing that up. So, what I do in clinical practice is I often tell the parent that I'm going to see the child only for a couple of hours. You are going to be there 24/7. So, I want you to be the consultant for your child, and you give me a feedback about how the child is kind of progressing with the chief complaints of the mental health issues. Also, I give them that unless you give me a feedback, I'll not be able to help you, and there are some things which have to be done on a regular basis. So if I have to see you know very openly about what are the all the task is not with the mental health professionals, and we also
Right.
contribute a little bit. So when I'm taking that on, I would say, healthy lifestyle and life skills are the two basic things which everybody should know. And as Dr. Sameer said, psychological first aid. Somebody is not saying, how are you? Okay, more about it. And the least that you can do in the conversation is building up hope. That, as you said, coming up, telling us, you that they have an closing. Lot of celebrities.
Sorry.
So
Is your connection?
there is
Am
one
I
downside.
Yes, I also did
Dr.
not
Preeti, I think
understand
your
quite a bit
internet,
of
your
it.
connection is a little
Hmm.
unstable. Dr. Preeti? Slightly
Okay,
unstable internet.
Can
Yeah.
you hear me now?
Yes, we can hear you. Yeah.
Okay, let me try change. Oh, okay. So, what was another point, Shipra? I hope I've addressed all your issues. I'm not sure
I'm
that I
sorry,
did.
Dr. Preeti, but I missed all of it because your connection was not right. I could not really
Okay,
understand. I was
I
practicing.
just said partnering with the parents and keeping them as a part of the team.
Yes,
I
yes,
often tell the adolescent, you are the captain, and we
yes.
are your teammates, the parents and the physician with that, right? So
Right.
giving the control to the adolescent, and we say we are your coach and cheerleaders. So
Hmm.
everybody has a role to play. So when we make a plan, everybody has a role to play, and the role should be defined properly. I feel that really helps a lot.
Yes, that does. When you mentioned that spending alone time with the teenager first, right? That
Yeah.
is very very important because that is when they start taking responsibility for their actions and for their lives and their goals also. If it's always with the parents or always parents being involved, then that sense of responsibility for less is somewhere lost or it's not taken. So yes, that alone time with the teenager and then incorporating the parents also all together is necessary, right? Thank you so much
Right.
for the insight.
Thank you. Thanks for the questions and the insights. I obviously we have an important segment. Sorry, I apologize about the cooker at the back. Yeah, sorry. Um, obviously, we have digital detox as one of the questions, but in in view of the short time that we have, we also had contraception as part of it. But I'm
No,
sure we can have
I
certain
think let us go
important
for
things.
the digital
Yes, we are
detox
going
because
to.
that seems to be need of the hour.
We will do a digital detox if we have time, but I also wanted to talk about the red flags in terms of, when to refer, routinely or as an emergency in routine gynecological examination. So any red flags that you would say that, have to be immediately, flagged up to the psychiatrist. And then we'll go to the digital detox and then probably take the final comments. Dr. Parikh, red flags in terms
Red
of
flags
in
to
history
me
or
would be
behavior.
red flags to me would be any kind of marks that you see in the body in terms of self-cutting. To me, that
Mhm.
would probably be it. Drastic change in weight, amenorrhea, obvious mood changes, very frequent somatic thing. That's about it.
Zoning
Sure.
out might be one also I've seen many times in adolescents when they are not opening up or they don't understand what they're going through.
Right. Dr. Preeti, anything to add?
So, any change in behavior and loss of interest in activities previously enjoyed for more than 2 weeks, lasting on most days, affecting the functioning of the child, is an indicator to ask for signs of self harm or suicidal behavior. There are times when things don't go your way, and young people often think of sometimes ending their life. Has this thought ever crossed your mind? I think that is the bottom line. We need to, because 90% adolescent suicides are impulsive. So like, we have to, so the mental health falls across a spectrum. There not be a frank mental disorder. The mental distress itself has to be picked up early.
Mm-hmm.
It's,
Right,
it's
right.
simply saying that
Sure.
the parents
Okay.
and the practitioners, we need to be better listeners to our
Yeah.
adolescents. Sometimes
All
clear
right.
signs are given
Yeah.
and what they
So,
need,
Shipra,
but
just
they
a
miss out.
moment. Sorry,
Mhm.
Shipra. Dr. Parik, I understand. I saw your chat. I think you've got to leave for a media commitment. Just before, I mean, we'll continue with the digital detox with Dr. Preeti, if that's okay. But just before you leave, Dr. Parik, we just wanted to ask you one very important question. See, what are one or two, small, immediately implementable changes that you would recommend for gynae clinics to become more adolescent friendly, more adolescent mental health friendly? And what is it? Because you've done so many policies and school health policies, mental health policies. So today, as a takeaway for us, as a Karnataka State of Obstetrics and Gynecology Society with Adolescent Health Committee, what would you recommend that we do so that we can sensitize more gynecologists towards adolescent mental health?
I think it's to do with the openness towards mental health more than anything else, very honestly. I just feel that the physician community by large, I mean, the reason I came here was primarily because it's not often that a gynecology forum has been asking to talk on mental health. I say the way it is, there's no point beating around the bush, right? Um, I would love to have such conversations with all specialities who are the first line of contact, right? And I think that's important because the attitude of the physician towards mental health is one of the biggest hindrances of people taking mental health issues. For example, somebody says, I had a bad exam, and you say, oh, it doesn't matter. Or if you say, I'm having a relationship issue, oh, this is not your age, don't be silly. So the moment you become almost a parent or a teacher figure, where you are being very directive, very prescriptive, rigid, as though you've come from Jupiter and they've come from some other planet, that's the problem. So it's your openness to absorb and explore moods, life, friends, and it'll help you if you are doing an adolescent um, clinic to probably also look at how your clinic looks like, right? You'll never have a clinic like I have. I mean, and I can certainly not have one like you have. But to give you an idea, my clinic would be what you're seeing here. It has lots of plants, nothing between me and my patient. A table is on the side with the computer and where I'll write. It's an open space, it's very comfortable, there's a bit of music going on. And the feel in there is that, just come and have a chat. You
Right.
obviously can't do that, but if you have hours dedicated for adolescent, you could probably look at where you are sitting, how you are interacting. Some of those things will actually make a difference.
Right. Oh, that's very well said. So thank you. We'll take some of those practical pieces of advice. Thank you
Thank
very
you.
much for being here.
No, thank
On behalf of the President, Dr. Durgadas Astrana, the Secretary, Dr. Shobha, and the entire Adolescent Health Committee, we thank you for your time and valuable inputs. And we will be in touch for any collaborations in the future. Thank you,
Surely.
sir.
Thank
Thanks.
you. Thank you.
We will carry on.
Thank you,
Thank
Dr.
you.
Samir.
Thanks. Thank you. Thank you. Right. Dr. Preeti, and also all the gynecologists, was feeling a little, sort of, let's say, limited. Now I think we can have a little open discussion also about the digital detox. So I'm just going to go back to that. And this is very, very important. There's no doubt about that. As Dr. Shobha rightly said, Dr. Preeti, we do see a lot of teens with sleep problems, fatigue, headaches, and that leads on to menstrual disturbances, that leads on to PCOS, etc. How do you screen for problematic device use, right? Maybe any of the gynecologists can give a real world example. What do you have to say about screening?
Yes. So as I said before, how do you feel after using the screen is one very kind of non-judgmental and an open-ended question to ask, right?
But they will say they have felt good. They've played a video game or
Sometimes
they
I feel
watched
very
something on Netflix.
happy. Yeah, they felt good. Okay. So if there is a problem, they fell down,
Many a
then you
times it is a
echo that. But
dopamine
once they feel,
surge.
they say, absolutely. So then there are these 5 things which we need to screen for. Okay. Do you feel an excessive desire to be on the screen even when you're doing something else?
Yeah.
Like you are, like, for example, talking to your friend in person, and then you say, I have to see my phone. Yeah. Or you're talking to your parent, or you're doing some exercise without the phone, and then you say, I need to see. So there's a strong craving. Once you pick up the phone, you are not able to put it down. Yeah. You know you have other work to do. So there's this loss of control over use, right? This is so craving, loss of control. Then compulsive use, like craving is there. Sometimes you're able to control the craving, but compulsive is, I get anxious, I start getting palpitations, or I start feeling jittery, that unless I use it, only then I feel relaxed. Okay. So
Right,
is there a
right. Yeah.
compulsive use? Are you using the screen for coping? I feel down, I immediately take the screen. I don't think about the problem, right? What it is. I had a fight with my friend. Rather than seeing what the fight was and how it went, I just use the screen. My father shouted at me. I want to get a dopamine, like you said. I use the screen. So I'm using the screen for coping. Also, I'm using the screen excessively despite consequences. I know that the screen is affecting my studies, is affecting my social interaction, but still I continue to use. So we call them the 5 C's: craving, loss of control, compulsive use, coping, and in spite of consequences, we continue to use.
Right. Yeah. Wonderful.
Right?
5 C's. Hmm.
As also, ma'am, I see patients like you said, to add some real life
Give a
example.
positive, definitely.
Sorry, I think her internet connection is a little.
Yeah, I
Say
think
what?
let us take the real life
Dr.
example
Preeti,
from Shruti because she has not
Dr. Preeti, can you
contributed,
hear
Yeah.
us?
not been able to talk. Yeah. Hmm.
Yeah.
Yeah,
Sorry,
yeah.
Preeti, we lost you.
Yeah,
Dr.
yeah,
Shruti,
yeah.
please
Yeah, I
carry
can
on.
hear you.
Yeah. Yeah. Dr.
Hello.
Shruti had something to say.
Yeah,
Go
yeah,
ahead.
ma'am. Yeah. I get girls like the mothers keep complaining that they don't get enough sleep, and I mean they sleep too late in the night, and also and when I ask them, they feel very low in the day, and in the classes they tend to get like they just nap, they tend to take a
Nod
nap
off.
or something
Yeah.
like that, nod
Yeah.
off. Yeah.
Yeah.
Like that they have those, and when you ask such questions to them, then we also we get the history that they drink too much of those caffeine drinks, colas, and all that. And maybe by that we can get an information that they are maybe they are used to late night chatting and all. Eventually they get late sleep, and they tend to the sleep wake cycle is all disturbed. They get up late, and then like that. So these disturbances keep happening, and with that also we can take the history of this excessive screen use. Uh,
Yeah. Yeah.
yes,
No,
ma'am.
true. Thank you. Thanks. So, Dr. Preeti, what do you have to say about that? Like poor performance
Aruna,
because of Dr. Preeti, are you there?
Preeti, if I may say something here.
Yeah, I just put off my videos so that you can hear me
Yeah, I
better,
think that
because
was
I
a good
think
thing.
my internet is going. Yeah.
Preeti,
So I just
I
put off
just
my
wanted
video for
to
that reason.
give one input here, which I have gathered over the years. Aruna?
Yes, please go ahead.
Yeah. So, a couple of years back, we had a national conference at Kolkata, and they had this influencer come in and speak to the delegates. Mr. Gaur is there, no? Mr. Gaur, the one who is on the YouTube, who is a YouTuber and an influencer. It looks like one Swamiji. I think all of you must have heard him. So he was speaking, and then on adolescent health only. In the end, I asked him what can be done about this addiction to digital media, addiction to mobile, internet, etc. So he did not have an answer. A man of such experience, he did not have a straightforward answer. He said also, "I'm helpless. I don't think I can have a solution." But there is one thing which stands out, and that is the device offers them, the adolescents, a very interesting perspective of life, in the sense they have much more interesting things to browse and see and understand, and play games or entertainment or chatting with friends. And sometimes the worst part of it, like indulgence in internet sex, etc. But then he said that what can be done is to create an equally colorful atmosphere, an equally interesting life around them. Then probably they will not go into they will not try to live in the virtual world for so long.
True.
And that felt like an impossibility to me.
Yeah.
So then I was also thinking, what can be the solution for this? Because parents are quite defeated today. They are kind of wanting, every time they bring us for a physical health issue, they will also tell about this abnormal sleep, abnormal dietary pattern, and also all the time on the mobile. Constantly they tell us, and they
Dr.
ask us for
Preeti,
solutions.
what are your
So Dr. Preeti,
realistic
what have
digital
you been
detox?
doing for such parents? How are you
Yeah.
helping them? Yeah.
So I'm at an advantage being a pediatrician. I get to see them in their small babies. So my anticipatory guidance starts from right there. For any disease, adolescent is too late to put
Sorry, Dr.
those
Preeti,
child.
again,
What
we
are
are
the rules regarding that?
having
Oh
a very
God.
chip-chop,
Okay.
yeah.
Now can
What
you hear me?
she's
I'm so
saying,
sorry.
Aruna, is
Yeah,
adolescent is very late stage to intervene. One has to intervene
No,
from
that's true. Yeah.
childhood.
yes.
Yeah.
Yeah, we have to intervene right from childhood, right? So
Yes.
when we give the first phone to eat food at 2 years of age, right?
Yeah.
So it starts from there. And I often ask parents, will you ever send your child in a dark street in the middle of the night? And they say no. I said, when you give the phone to them without monitoring, you're actually sending them into the dark street. So you have to be very cognizant of the fact that when you are giving the phone to them, for why are you giving the phone? What is the purpose? What do you want to achieve from that? And without monitoring, giving unmonitored excessive use is definitely not the way to go. So that is one thing. The second thing is parental use themselves. They have to be role models, right? If they are going to doom and do scroll and doom, then they're definitely going to, encourage. The third thing about mental health. So
Dr. Preeti, sorry, we're losing you quite frequently.
I think Dr. Shubha
have the
Badami
underlying
has
organ.
also voiced the same thing as Dr. Preeti.
Yeah.
That
Dr. Preeti, you said one is, of course, setting an example. Second is starting intervening as a child. We heard that. Go ahead. Hello. Are you able to
Can we
hear
ask
us?
Dr. Shubha Badami to unmute, because she seems to be.
Hello.
No.
Dr.
Preeti
Preeti.
will talk. Preeti is the best person to talk to you all.
Joined here.
Hello,
Okay.
Dr. Shubha. Hi, good evening. Welcome.
So I just joined. I wish, I could not answer to mind. So I couldn't join early.
Dr. Preeti.
Dr. Shubha Badami, are you a mental health specialist?
No,
What's
not at all.
happening?
No. She's a very, 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 very famous
She's a
pediatrician.
pediatrician.
Ma'am, hello, ma'am. Until Dr. Preeti joins, can I add a point here?
Yeah.
Yeah, I have actually, I don't have a personal experience, but I have had a conversation with many of the pet parents, like those who have dogs and cats and at home. They tend to like their kids, like they have that environment at home with the pets that the kids don't ever feel like using the phones. Okay, that's what I have experienced personally when I go to their homes. They have that kind of environment. They play with the pets. They do all sorts
Yeah.
of things with the pets.
Yeah.
So
One
that's
big
what
incentive for buying a
yeah.
pet. Yeah. Right. Yeah, sure. Dr. Preeti, so sorry, we couldn't hear you very clearly, but I'm sure you
Can you
have
hear
plenty of
me
inputs to give
now?
on this.
ಏನ್
Hello?
ತಂದಿ
Can you
ತೋರ್ಸು
hear me
Yeah.
now?
Yeah,
Can
we
you
can
hear
hear you. We can hear
me
you.
now?
Still a bit chip chop. Still a bit chip chop.
Okay. So
Anyway,
what
what we will do is, in the interest of time,
important
we
thing I
will,
want.
Dr. Preeti will get back to you on WhatsApp. Could I have from all the panelists here, Dr. Bharti, Dr. Shruti, Dr.
I
Aarti,
think Dr.
and of course
Bharti
Dr.
has left,
Preeti?
Aruna. So
Yeah,
maybe
she
you can
said she
take
would leave. Could
from
you
Shruti
please,
and
all of you,
Soumya.
give one message to gynecologists across the country, across our Karnataka, about their role in adolescent mental health, and what would that be, please, as closing remarks?
Yeah. I think we can take from Shruti and
Yeah, ma'am. Like I feel like how we started the discussion. Every time an adolescent enters our OPD with any problem, maybe
1
irregular
minute, Shruti,
cycles or
1
acne.
minute. Aruna,
Yeah.
can you stop sharing? Maybe that is
Yeah, we can. Yeah.
because
I
I
just
think the
had,
questions you have finished already.
yes, yes.
So that
Yeah,
on
that's
the
what.
gallery we can connect better.
So every time enters, like we can spend a few minutes. So keeping the mental health as a priority along with her physical health hand in hand. So a few minutes to spend. Like, does she have any problems with the study with at home with phone or with friends? So all the issues we can just put in some questions to her so that they also feel more comfortable and bring out. As I see in a government setup where I work, we are seeing more and more teenage pregnancies, more and more POXO cases, and they are entering after 24 weeks after the MTP, we are getting pregnant because they tend to hide the pregnancy with their mothers also. So in the past few months only, we have delivered many term pregnancies at 15, 16 years old. So
Oh,
these
how
things
sad. Right.
we are
Mm.
facing a lot. So I think we have to address each and every adolescent coming to our OPD, not only with the PCO problem or with the menstrual cycle problem, with all these issues. Invariably, we are seeing these teenage issues or the relationship issues with them. So that's what I wanted to tell.
Yeah, true, true. Absolutely. Dr. Parimala, you put in very important points: parental role modeling, of course, digital free zones at home, and parental co-viewing and interaction. Yeah, absolutely. Thank you for that. Dr. Preeti, maybe I think all the other panelists have left. So, Dr. Preeti, if you can try and speak for your closing remarks.
So can you hear me first?
Yeah, yeah, we can hear you now. Yeah.
Yeah. So what I feel is that, all all gynecologists should do a screen for mental health disorders. So if you have the screening tools with you ready, I gave you a list of screening tools in the chat. And if you could have that ready with you, it would be helpful. Asking the 2 screening questions I've already told you. Spending time alone with the child for 2 to 3 minutes. 2 to 3 minutes for all children above the 10 years of age should be the rule in your clinic, that any child coming, you're going to spend that time with that child. Also having a special time for adolescents, that would be great. And keeping, even if you refer the child, keeping the collaboration with the person to whom you have referred would be important, because you are the primary physician. I think in short, that would be my kind of take.
Absolutely. Very, very valid points, practical points. Dr. Soumya, would you mind giving us your closing remarks, please? Dr. Soumya Mani. Dr. Soumya, unmute, please. Yeah, yeah.
Unmute ಮಾಡ್ಕೊಳ್ಳಿ.
Yeah, keeping the screening tool, it's very important, as Dr. Preeti has told. And we should intervene with adolescent people as early as possible and as close as possible. In that way, it's better to start a friendly adolescent clinic on a fixed day of our OPD, or maybe on Friday evening or something like that, so that we can keep more time for them. And also, it's very important to focus on high risk sexual behavior because we are coming across with lot of teenage pregnancies nowadays.
Yes. Right. Absolutely. Thank you. Thanks for that. Yeah. Dr. Shipra, would you
Usually,
mind giving? Sorry. Yes,
no,
yes. Please go ahead. Shipra,
no,
even
you
you
were
had
asking
something to
somebody
say.
else.
Just one thing I
Shipra
want
Lamba,
to add,
our psychologist. Yeah.
ma'am, I
Better.
want
Go ahead.
to add if this point can also be asked from plus 15 age of teenagers, that if they are sexually active or not, and if they are, yes, then what is their knowledge? How, where are they? What are the risk factors for them? And if they are not, fine, but they're directly asking them if they are sexually active or not would also open up a what you say, a path for them to have their queries or
Yeah.
share their fears.
Yeah.
Yes, absolutely. Dr. Shobha, you have something to
Yeah, I
say?
think I agree with Shipra that there is a lot of interlinking between sexual reproductive health and mental health. I said that earlier also, and I
Mm,
find that to be true. And nowadays, when there is seems to be some kind of an unwritten permission or whatever for adolescents today to have friends of the opposite gender, and some of that might be intimate relationships also. And the problem is, as correctly told by um, her name is Shilpa, isn't it? Oh,
Shipra.
Shipra. As correctly told by Shipra, this kind of indulgence is absolutely without any knowledge about appropriate safe sexual practices. And why I did not raise this earlier is it kind of dilutes the discussion, which we don't have time for. So
Mm,
we have to bring in that conversation and tell
yes.
them, because mental health really goes for a six when there is an unwanted pregnancy
Yes.
or there
So
is a major sexually transmitted infection.
Mm.
They absolutely, they are shattered. I tell you, there is nothing worse than that for them. It is all
mm-hmm.
right to see all that in the movies, but what happens in real life is the boy just gets to walk and the girl is left holding the entire blame, and
Yeah.
the stigma
True.
and the miscarriage. And we
Yeah.
are very fortunate that, barring 18 years, above 18 years, we absolutely have very smooth processing for the MTP Act in our country. At least that mercy
Mm,
is there. But then the woman really, the girl really carries that in her heart. So they are very closely linked, and we need to integrate it
yeah.
more and
Sure.
not
So I
segregate
think
it.
with
We need to
absolutely, I think
integrate it more.
Dr.
Yeah.
Parimala and Dr. Gangambika, Gangambika, yes, suicidal tendencies. We did talk about a few red flags. As I said, there's a very vast topic: eating disorders, digital detox, adolescent mental health itself is like a huge topic. We tried as much as possible in 1.5 hours. But the head screening tool, Dr. Preeti, would you mind just sharing it again? We've already spoken it in our previous about it in our previous webinars,
Yes,
but
yes.
it's there's no harm in reiterating that. If you
Yeah.
could just share that headers tool for all of us to sort of incorporate. I've already incorporated it in my adolescent health. History taking sheet. So I do have a history taking sheet, and I run adolescent health clinics in Cloud9 every Wednesday. But I've sort of now made it all through the week so they can walk in anytime. Initially, I had kept Wednesdays for it, but now I've just kept it anytime. They can
Yeah,
come
that is
along.
another thing
Uh,
I wanted to say. Yes,
yes,
Aruna, I
yeah.
agree with you.
Yeah.
There
And the
should
pro
be no
forma is all
barrier of
set.
time.
So if
Yeah.
anybody wants a pro forma,
Yeah.
certainly please reach out. And both Dr. Preeti and I and many of the others can help you with the pro forma, which includes the header screening. Dr. Preeti?
Aruna, one thing I wanted to ask you, whether,
Yeah.
we can do a little more from the committee, like whether we can have some messages for the social media from doctors to patients, so to
Yeah.
adolescents
Yeah.
especially, whether
Yes.
because we share so many other things, why not tell them where services are available, or even that
Yes. Yes.
there
Absolutely. I
there are
agree.
services. Provide a link and through the link they can source, one of the clinics which are listed, and offer them video consultations because they may not be in the same city.
True,
So,
true,
and
true.
most of it is counseling. So you could do a kind of joint counseling. For example, we can request Dr. Preeti to be there along with like that. We can ask Dr. Shipra to join the consult like that. So can we have some specialized
Yes.
services for adolescents? I think we
Absolutely.
need to think
Absolutely.
about doing more because, of course, all of us spoke about it today, such wonderful inputs. But is it kind of
No,
actionable? You
it
have
is. It
to
is. It
look
is.
at
It is
actionable
certainly actionable.
points.
Yeah.
Yeah,
Right.
and make it happen actually, to
Yes.
may have
No,
some
no,
impact.
absolutely. I will,
Mm.
as I said, I think even Dr. Preeti was suggesting we should have a webinar series, and the headers thing, we will share it, the pro forma. Dr. Preeti, you shared it with me before, and you can share it again with me, on the WhatsApp group.
Yes.
And I will make sure that everybody gets it. And with that, may I
Shall we close,
request?
Aruna? It really is
Yeah,
late.
absolutely. With that, I thank everyone for sparing their precious 90 minutes for this very important session on mental health in general, but especially adolescent health. And thanks, Dr. Shubha, Dr. Parimala, and Dr. Bharti, and all the panelists. Thank you, Dr. Samir. Of course, he's left, but thanks to him and our dear Preeti, Dr. Preeti Galgali, who is
Thank
always,
you,
always
Preeti.
ready
Thank
to
you so
support and
much.
encourage and share all her beautiful, valuable insights. Thank you, Dr. Shobha, for co-moderating it. Shruti and Soumya Mani, thank you so much for being panelists, and Aarti as
Bye.
well.
Good night.
Thank you,
Thank you,
and good
Aruna,
Thank
night,
for
you.
doing
and have
such
a
a
good
Bye-bye.
sleep.
wonderful job
Have a
for
good
the
sleep.
committee of
Thank
KSOGA.
you.
Thank you. Thank you
Thank you,
very
Aruna.
much. Thanks,
Bye-bye.
Shipra. Shipra,
Bye.
thank you very much for being there. Thanks.
Thank you.
Bye. Thank you. Bye, Dr.
Thank you
Preeti.
so much, ma'am. Thank you.
Thank you. Good night. Thank you.